Good evening. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas, and I'd like to welcome you to our COVID-19 vaccine town hall. Before we get started tonight, I'm asking Dr. DeLisi to say a prayer for our town hall tonight. Dr. D.
Thanks, Terry. Father, we thank you for this opportunity tonight to share with our community that we love. We pray that you would guide our words, our thoughts. Lord, we know we don't have all the answers, but you do. We pray that we would be bearers of truth, words that would encourage, that would challenge, and that we would decrease and that you would increase. In Jesus' name, amen.
Amen. Thank you, Dr. D. His words are perfect, bearers of truth, and that's what we're here for tonight. We appreciate you joining us, and we're excited to spend the next 45 to 55 minutes to talk about COVID in Mount Pleasant, Northeast Texas, but also about the vaccine and the things that are going on. We're blessed at Titus Regional Medical Center and in Titus County to have the best physicians that you could possibly have on a medical staff. We're truly appreciative of our doctors here at Titus Regional Medical Center, and tonight you're going to see some of those doctors. Our goal tonight is to be honest, to be transparent. I've been blessed for the last 16 months to sit with the medical staff at Titus Regional Medical Center and listen to them talk with each other, banter ideas, look at data, and share information. Our goal tonight was to share that information and be transparent with you, the community, so you can have some of the same information that we're seeing. Things are dire right now. We're not going to sugarcoat it tonight. We're not going to get into politics tonight. We're going to be honest. We think that's our role to protect the health of Northeast Texas. With us tonight for the Family Care Center is Dr. Craig DeLisi. From the Pediatric Clinic of Northeast Texas is Dr. Stagg, who celebrated a couple weeks ago 40 years of practice at the Pediatric Clinic and at Titus Regional Medical Center. And then Dr. Will Hooks, Chief of Staff, longtime resident and grew up in Mount Pleasant, Texas, but Chief of Staff and anesthesiologist for Titus Regional Medical Center. We believe tonight we have three great docs to talk and represent our medical staff, and we have our cell phones with text messages from other docs. We could only fit 4 people on the screen, but we've got some messages going across as well. So we're excited tonight. I want to start with Dr. Stagg and let him just lead us off with a couple comments, and then we'll go to Dr. DeLisi and Dr. Hooks. Dr. Stagg?
Sure. Referencing back to my previous town hall meeting, I would just emphasize the fact that we're trying to present some information for the community to understand why we advocate vaccination. There's been no other modality in medicine that has made more impact in infectious disease treatment than vaccination. And we are firm advocates of vaccine. I think you'll hear tonight from all of us a united message in that.
I'd be lying if I said I was happy to be back here doing this again. I wish we didn't have to be, but here we are. We'd like to have a chance tonight to let people ask questions. I know that a lot of people have questions, and just to give people a glimpse and understanding of what we're seeing. But another reason we're doing this is because during the pandemic, we've really had no shortage of information about COVID, but good information has been in short supply. There's a difference between knowledge, which is just knowing a fact, and wisdom, which is based on experience. I think the average person doesn't know what or who to believe right now, and so many people feel compelled to become experts on everything related to COVID, and that's a burden that's too much for anyone, including ourselves. But the result, I think, is that there's too many voices, which leads to confusion, and we have information overload. Truth is getting harder and harder to discern in our world in general. I think the pandemic has just magnified that fact. As a man of faith, but also of science, it concerns me greatly that as a society, we've lost the ability to distinguish between fact and opinion. That's a big deal. There's such a thing as truth. There's objective scientific truth. As a Christian, I believe there's moral truth. But if we can't identify that truth, it makes it very difficult to navigate the world that we live in, especially in these times. So I hope tonight we can do some of that we can share some wisdom from our experience, from what we're seeing, and truth as we see it, with the hopes that some of the murkiness of the waters of COVID and the world we live in will be made more clear for some of you.
Good evening. Thanks for joining us. I appreciate Terry asking me to be a part of this. To say that we're in a healthcare crisis is not overstating it. We are in a healthcare crisis here locally in our town and surrounding counties, in the region of the state, and the state, nationally, globally. And we're feeling the effects of this latest surge now. We see it on the news when you hear of ERs and communities having to shut down so they can shunt resources, human resources, over to larger facilities because they don't have the staff to care for the influx of patients that everyone is seeing right now. We're not unique in that scenario of being a high volume of patients. And we're not unique with having struggling to be able to staff and take care of all of the patients that are coming in, while other area hospitals have either gone on divert from time to time or even, again, can't accept transfers because they're full. We feel the effects of that. And so, part of my job as chief of staff is to work closely with the chief nursing officer, and a large portion of our day is taken up by looking at our census of COVID patients on our COVID floor, our census of COVID patients within the ICU, and the number of people in the ER that are wanting to get care, both with COVID and non-COVID disease, and just and working the problem daily. It's a day by day problem that we're solving with how we staff that and how we take care of the patients in the best way that we can. And so, by all accounts, this surge is going to get worse before it gets better. And we need the community to help us by doing everything they can to protect themselves from getting critically ill. The best way to do that is vaccines, which hopefully we'll be able to discuss tonight. We'll, identify the information that is considered fact. If I express an opinion, I'll identify it as an opinion as well. But I hope that you come out learning something and just feel more at ease if you were on the fence of getting the vaccine but feel that that's something that you want to do. I hope that we're going to be able to help you feel better about that.
Thank you, docs. Truly appreciate it. And thank you for joining us tonight. And thank you all for joining us as well. My goal tonight is simple. I want to decrease the spread of COVID in Northeast Texas, and I want to increase the vaccination rate. It's proven that it will decrease the spread and will save lives, and we've seen it over the last 16 months. I'm not going to get into details tonight on some of our numbers. We'll have our update tomorrow on Facebook Live as we do normally. We're sitting at 20 patients today, and it's been just a crazy day. You're going to see some messages come out from me over the next few days of things we're going to move around to expand and move different people on the floor to make things work. We are holding patients in the emergency department. We had 6 patients COVID this morning that we're holding in the ER. We've got them all in beds tonight, a part of our 20. However, we have hospitalized patients that are holding in the emergency department. This is consistent with hospitals around Northeast Texas. I was on the phone a few minutes ago from a friend's about 60 miles away asking us to ship 10 patients, and they would bring the nurses if we just had space for them to put the beds on the floor, and we don't. So that's the struggle we're dealing with right now. So I'm going to start and talk about the vaccine. Dr. DeLisi, I'm going to start with you. One of the questions we received over the last day or two was, why take the vaccine if we can just get sick and spread it? And are vaccinated people causing this most recent heavy spread?
Yes. So kind of a two-part question. The quick answer to the second part of the question about are vaccinated people causing the recent heavy spread, I'd say no. Largely it's unvaccinated. But to answer the question, yes, vaccinated people are getting it. So, vaccines don't perfectly prevent all illness unless you had one that was 100% effective, which doesn't exist. We're so blessed that we have the ones we have, especially the mRNA vaccines, because they're 90, 95% effective, maybe a little less so with COVID. I mean, with the Delta strain that we're seeing now, but they're primarily effective in preventing serious illness and death. And that was the plan from the beginning, the hope from the beginning, and that's certainly what we're seeing. As far as some specific numbers, just to kind of put flesh and bones on it, the difference between being vaccinated and unvaccinated is still night and day. If you're unvaccinated, you have about an 8-time higher chance of getting infection than if you're vaccinated. You have about a 25-time greater chance of being hospitalized or dying from COVID right now. Currently vaccinated patients have a less than 1% chance of catching COVID. But as far as of new cases that we're seeing, they probably represent between 10 and 20% nationally as well as locally. I've kept my eye on it at our clinic. And that's just because we're seeing so darn much. I mean, we're starting to see numbers of new cases that are comparable to what we were seeing in January and February when the wheels were starting to come off the system a bit right before the vaccine rollout. So one of the main reasons for this, by the way, is because vaccine-induced immunity is mainly in the bloodstream with the antibodies that we have. We also have some immunity, of course, in our face and our nose, but the levels of antibodies in our nose are not particularly high. They are in the bloodstream, which travels through our lungs and protects our lungs. So a lot of people, and we're seeing this consistently, a lot of people with the vaccine are still contracting COVID. They're getting what seems like a mild cold, sinus infection, occasionally some cough. Generally speaking, they haven't been very ill, but it's not moving into the lungs. In my mind, there's kind of two versions of COVID. There's COVID with all the yucky, terrible flu-like symptoms that nobody likes, but it's a nuisance. And then there's the pulmonary disease. And when it gets into the lungs, it's very bad. And those are the people that often end up sick and in the hospital. So the vaccine is doing a fabulous job of protecting against that. Locally, as we've seen our numbers really rise significantly in the last month, I've talked to the hospital list, and as of today, of all the hospital patients we've had in the last month, we've only had one that's been vaccinated, and it was someone who's immune compromised. They're on immune suppressants because of rheumatoid arthritis, and so the message is clear regarding the vaccine. Our hope in the beginning was that it would be effective. I don't think any of us could have hoped it would be would have expected that it would be as effective as it's been. So if you're on the fence and you're hearing about breakthrough cases, that sort of gives the impression that it's a vaccine failure. It's not. It's a mathematical certainty that something that's 95% effective means that 5 people out of 100 who are exposed will still get it. We're seeing that right now. We're seeing numbers because so many people are becoming infected. It's still traveling through the community. But as far as protecting those same people from ending up hospitalized or dead, it's doing a remarkable job. And so very, very grateful for that. And to answer, but also to be fair, vaccinated people can spread the disease, just like unvaccinated people can if they contract the illness. Their levels of virus seem to clear faster, however, so they're probably contagious for less time.
And we've seen, from a hospital perspective, 25 employees over the last 10 to 15 days contract COVID and have gone off duty. A portion of those have been vaccinated. They weren't as sick as some of the unvaccinated as well, but you're seeing it. So it is possible. And we are treating even vaccinated and unvaccinated outpatient with Regeneron and other patients as well, and it's been effective. But the state of Texas has said and puts out data that 95% of hospitalized patients are unvaccinated, and our numbers in Northeast Texas are very consistent to that, and a little bit higher than that. I'd like to go to Dr. Hooks. There was a question, and I think it was from Mr. Foster. It was a great question. What resources are available for those being released from TRC? For example, if an older person lives alone and needs oxygen or to be checked on and lives in a rural area, is there a step-down unit or services that help those with active COVID cases?
That's a great question. We're blessed with a great case management team. We have a lot of strong, passionate nurses who take their job very seriously and are tirelessly working to help identify resources for patients that are being discharged. It's certainly ones that may still require oxygen. So the case managers work with home health agencies. We've got several in the area that help in that regard. We don't have a step-down unit outside of the hospital at this time. However, it is something that we're beginning to talk about of how that could work for those that live remote and alone. And so hopefully we'll be able to find a solution for that group of people. Again, we don't have that right now, but it's something that we're actively looking at. But again, with supplies for pulse oximeters to go home with, oxygen and that sort of thing, those are typically available and arranged with home health and by our case managers. I hope that answered that question.
No, I think it was great. And I think just so everybody understands some of the things we're talking about, We were in a meeting today talking about what our next steps for a hospital. We're looking at setting up some inpatient outside the hospital over the next few weeks if it continues to increase. We spent some time with our doctors yesterday trying to project what the spread would look like over the next 45 and 60 days. And we're starting to think, what are the opportunities that we would have to take outside the hospital if it got to that point? Thank you, Dr. Hooks. Dr. Stagg, with 40 years of pediatrics in Northeast Texas, want to just throw it to you with school going back and the spread and the Delta variant, everything we've seen over the last few weeks. Would you like to just tons of questions we've got about going back to school and the impact on pediatrics, and I know you've looked at some things over the last few days. You want to just give us an update from a pediatric perspective, and then your thoughts on going back to school.
Sure. Going back to school is always problematic for the pediatricians because that's when the kids that have been home all summer get back together and they spread everything they've got. This year's been unique in that we've had a respiratory syncytial viral outbreak in June, July, and even going on now. RSV, or respiratory syncytial virus, does cause pretty significant respiratory disease that is oftentimes difficult to distinguish between that and COVID. So we do a lot of testing to ferret that out. It's as we talk about kids going back to school, COVID, of course, is a concern. And I'm going to stop right here and say we're going to come out with a very strong recommendation that children mask. I think there's some simple things that can be done to help mitigate the spread in the school, and masking, hand washing, sanitizing, distancing when possible are all good measures in addition to vaccines. Now, we don't have a vaccine for children under the age of 12 yet, but 12 and above can receive the vaccine, and we recommend that as well. I want to tie on something that Craig answered, and a good example of people that have been vaccinated getting COVID is very similar to what we see with pertussis or whooping cough. Whooping cough, that germ, which is a bacteria, is present in the nasopharynx of 30% of the population, vaccinated or not. So you're going to come into contact with that germ. The best protection for whooping cough for children is to get the vaccine, and it's mandated for children now, and that's why we don't see much of it anymore. If you don't get vaccinated, there's a really good chance that you're going to wind up being exposed and can contract the disease. Very similar situation with COVID, and the people that have had the vaccine carrying the virus. You don't necessarily have to be sick to spread it, as Craig pointed out, and the best protection is to be vaccinated. I don't know if I answered your question or not.
No, you did. You did exactly what I was hoping you would do. I got off the phone with Dr. Thurman, who was unable to be here tonight to join us. He is at a Meet the Teacher tonight with his second grade student. And they'll both be in mask. And he did tell me that his daughter is going to wear a mask to school. And it was important to him and his family that she do that as well. So I appreciate that. And Dr. Stagg said Titus Regional Medical Center, I know Dr. DeLisi representing the Family Care Center, are supporting the pediatric clinic, and we're putting out a message with them, with that message about going back to school and our recommendation that children mask and all people mask in that unit. Dr.
Terry,
Hooks,
can I
go ahead,
quick
Dr.
comment on that,
DeLisi.
just to dovetail off that of what Dr. Stagg said. You know, the concern with going back to school, and I think this has been spoken quite a bit in the media, but I think people need to know that it's true, is that, you know, this particular strain of COVID is very contagious. You know, the last strain was quite contagious, the original strain, you know, on par with influenza. This one is probably more contagious than chickenpox. There might just, the list of viruses known to humans that are more contagious than it is quite short. It's more contagious than smallpox. You know, for every one person who gets this, they probably spread it to 5 to 8 other people. And so the concern we have, and I just think this is going to happen, is the kids will go back to school, many of them, you know, minimally symptomatic, and then it'll just spread through the school like a wildfire, and then they'll of course bring it home. I'm not looking forward to the next couple of months because of it. You know, children still seem to weather this virus, you know, better than adults by and large. But when you talk about large numbers, sometimes you have kids who get very sick. The children's hospitals are as busy as they've ever been. I think someone told us last week that they have a record number of patients on ventilators right now at Dallas Children's and Fort Worth and in Houston as well. And so it's very concerning. And masking, we all dislike masking. I mean, there's no one who would say they didn't. But it is one thing that can lower the contagiousness of the virus. It can decrease the spread a bit. And because it comes in mainly through the nose, just having something over the nose is somewhat protective, not perfectly protective. If it's done by itself, it's probably minimally beneficial. But in conjunction with other mitigation measures, it's definitely helpful.
Thank you, Dr. DeLisi. I want to go back to Dr. Hooks and Dr. Stagg to talk about, a lot of the questions that we received over the last few months in the vaccine related to women. And then also, one thing we've seen in the last few weeks is we've seen more COVID positive labor and delivery mothers coming in over the last 4 weeks than we saw in the previous 16 months combined. So we're starting to see that. Would just like to ask Dr. Stagg, and we'll go into that question with Dr. Stagg talking about the impact of that on the infants in the nursery and his thoughts and what he's hearing from Shreveport and Children's as well. But Dr. Hooks, the question we had was, should females be concerned with possible future reproductive issues from the vaccine? And how did you form that opinion?
So I'm very glad this question was asked. A few people have reached out to me personally to ask my opinion on this particular issue. There's been no data to support the idea that vaccines may cause infertility. There's been quite a few studies on it, actually, both in men and women. And for the men studies, they looked at sperm counts in men who got the vaccine, both pre-vaccine and post-vaccine. And there were no differences in those counts in those men that were studied. And that was recently in an article released by JAMA, the Journal of the American Medical Association, in June of 2021. And to date, nobody has shown any signs of infertility as a result of the vaccine up to 42 days after receiving the full dose. Now, there are some studies where women who incidentally became pregnant while they were enrolled in the vaccine study, those patients were followed closely, and none of them showed any increased risk for pregnancy complications or birth defects. What we do know is that pregnant women who get COVID are at a much higher risk of getting much sicker than women who aren't pregnant. They're more at risk for severe illness, more at risk for needing to go to the ICU, needing ventilation or oxygen supplementation. There's a greater risk for preeclampsia and death. They're more likely to have babies who would be born preterm, and they're more likely that their babies would need to be admitted to the neonatal unit. And that's in pregnant ladies who are unvaccinated but get COVID. The studies show that women who are vaccinated not only make good antibodies for themselves, but also can provide passive immunity where those antibodies can be protective for the baby. And if they breastfeed and have been vaccinated, that is also another way that passive immunity is applied to the baby. So the American College of Obstetrics and Gynecology has come out, and they really are the authority voice in obstetrics, as well as the Society for Maternal Fetal Medicine. Both have come out strongly in support of pregnant patients or patients who are considering or trying to become pregnant to not delay getting the vaccine. There's concerns about, and we'll probably get into how the vaccine works, but briefly, the vaccine is injected into the arm muscle, into the deltoid, and it's not taken up into the body systemically. The messenger RNA, if it's a messenger RNA vaccine, once it's deposited, gets into the cells there in your arm muscle. And the messenger RNA then causes the production of the protein that allows the virus itself to infect the cells, but it produces a protein, not the virus. And your body then sees that as an antigen and creates the antibodies. And so the antibodies then are able to circulate through your system. But the ingredients of the vaccine itself are not. I think Dr. DeLisi is probably going to talk about how the vaccine was developed and that sort of thing, and I'll be happy to touch on it again. But suffice it to say is the vaccine is safe even in pregnant ladies or those that are considering becoming pregnant, and it's strongly recommended that they don't delay getting vaccinated.
And Will, I would say and dovetail to that, the data is very compelling that the vaccine helped prevent complications, but it also is compelling that women that are pregnant that are not vaccinated have a higher incidence of premature birth, complications at delivery, and even infant mortality. So that's something that concerns us. To speak to what Terry mentioned, we've had some mothers here that have delivered that have been COVID positive, and it just complicates our job as pediatricians to take care of those children. Terry mentioned and Craig mentioned, and you've mentioned, several of the hospitals have become full, and it's becoming more and more difficult to transfer people to those hospitals, just like Terry said. We're beginning to sense that, and if we have a child who's born to a mother who's COVID positive, it makes that transfer much, much more difficult. If that child is born and has difficulties that require to be moved to a tertiary care center, it's a difficult situation. So I would encourage people to just look at the data. The data is coming back and showing that the vaccine clearly has an impact in pregnancy and pregnancy outcome.
And not only in pregnancy outcome, but I think one of the main concerns I see with a lot of younger women who don't get it is, will this affect my ability in the future to get pregnant? Dr. Stagg, when you and I did the vaccine town hall in January, we addressed what we assumed would be the case, based on the science as we understood it, but we didn't have real world data. Well, now 7 months later, there's lots of it, and the answer is there's lots of pregnant women. It doesn't seem to be affecting fertility rates, either in women who have had COVID or who have had the vaccine. They seem to be getting pregnant at similar rates as they were prior.
That's why pediatricians have job security.
Another 40 more years. We'll be glad to hear that one. Dr. Stagg, I want to stay with one thing, and Dr. DeLisi, you can jump in as well. Angie Sines sent us a question. It was a great question. Can you help me understand why it's encouraged for expectant mothers to take the vaccine, but we're not ready to recommend the vaccine for children under 12? One point I'm going to make is I was on a call with the state of Texas earlier this week, and they talked about the White House's vaccine coordinator was on this call with the Texas Hospital Station Board, and he made the comment and gave an update from the FDA and from the different companies on the vaccine that the trials are still going on. And with vaccines for children, so under the age of 12, the data, the test have to be more than what they do for the adults. There's a lot more that goes into it before they'll approve or allow it for younger age children. So the tests are going on right now. They're continuing to go on. They don't have a date from the CDC or the FDA of when they will recommend it to go under the age of 12. But at this time, nothing has happened in the trials to stop the trials. So that's one of the encouraging things that they pointed out earlier this week. So don't know the date of when it's going to, but one of the reasons was given was there is more tests and more trials that happen for the younger ones. Dr. Stagg, you want to comment any more on that? Because I think it's a great question.
Sure. I think you gave an excellent explanation. The protocol for approval of vaccinations in children is much more rigorous than in adults. There's a lot more to consider, and sometimes it's more difficult to recruit a sample size or sample folks to get that done. It is ongoing as we speak, and as you mentioned, Terry, there have been no adverse effects that we've noticed yet, but it's not finished yet. And the FDA is not going to approve or issue an emergency use authorization until that happens. So we can't expect that till that's done. And I think that's proper and a good scientific way to do that.
Thank you, Dr. Stagg. Dr. DeLisi, I want to pull this one up to you, and I don't know if you can read it on the screen, but I want to appreciate the questions for Mr. Kennel. Mr. Kennel says, I'm worried about getting the vaccine. I personally know people who've got sick from getting it that were in the hospital nearly a week. It's scary. We get this question a lot, and I truly appreciate his bravery of putting this question out there because he's not the only one who has this question.
Sure.
Would you mind just encouraging him? The one thing I also want to say, Dr. DeLisi, is we're getting comments in response to that from people of our community who are encouraging him to get the vaccine as well from their own experiences. We truly appreciate our friends in the community as well. But will you address this for him?
I will. Yeah, that's a great question. Thank you, Mr. Kennel. And, so one of the things I think that does dissuade some people is concerns about the side effects that they'll get from the vaccine. Many people know someone who had a very bad reaction, or certainly most people have read about or heard of someone who has. The truth and the facts after, and at this point, I wrote them down, but let me see if I have them here. I don't want to say the wrong numbers as far as the number of vaccines. So at this point, we've given out over 350 million doses of the vaccine in the United States to 167 million people, which is just over 50% of the population, or just over 60% of the vaccine eligible. So we have a large sample size. We really do know what to expect. And for the mRNA vaccines, which are the Pfizer and the Moderna, probably a little more than 50% of people will have some side effects. And when I say side effects, I mean more than just a local side effect on the arm. That probably affects nearly everyone, probably 80% or more. But 50% or slightly more will have some other systemic side effects. For most people, they're mild, they're short-lived. They usually come after the second dose if you've never had COVID, or after the first dose if you have had COVID previously. Fever is uncommon, less than 10%. Fatigue is probably in nearly 50%. Headache in probably 40%. Vomiting and diarrhea is maybe 5 to 10%. Muscle pain or muscle aches in about 20%. And joint pains about 10%. And that's the reality. Now there are rarely, thankfully, with emphasis on the word rare, side effects that are more severe that people can have. A lot of people have heard about the blood clots with the Johnson & Johnson vaccine. As to date, those blood clots happened in 39 people out of 13 million doses of Johnson & Johnson vaccine given. There was also some cases of Guillain-Barré syndrome, which is a neurologic disorder with the Johnson & Johnson, and there's about 140 cases out of 13 million doses given. And then one other concern people have is inflammation of the heart, myocarditis, and those were seen in the mRNA vaccines, which we've given out over 300 million doses of. And at this point, there's only been 1,200 cases of myocarditis. So as you can see, for the rare side effects, the serious side effects, people getting very, very ill, they're incredibly uncommon and rare, thank God. And so I wouldn't let that dissuade you from it, because what you're comparing it against is not, it's not just you're not just weighing the issue of getting a vaccine or not getting a vaccine. What you're weighing is the issue of getting the vaccine or getting COVID. And I haven't said this yet. I was going to kind of save it for my closing thoughts, but I think it's important for people to hear that my opinion, and which maybe not be worth very much, but a lot of people's opinion, is that this virus will eventually touch everyone. If you haven't had the vaccine, if you haven't had previous infection, expect to get COVID. And I would say in the next couple months, expect to get it. And so, taking your odd, playing the odds against the vaccine versus the actual virus is really what you're comparing. And so many of the symptoms from the vaccine, the side effects, even the more serious ones, are things we see with COVID all the time. It tends to cause the blood clots and the heart damage as well. And so that's really what you're comparing when you're comparing the two. And I think there really is no comparison, in my opinion.
Thank you, Dr. D. I want to talk about the booster. We've got some questions on there, and I guess I'm going to open this up to all four from a booster standpoint. There was information that's come out today, and this is hot off the presses, and we've got a lot of research and things to work on over the next few weeks. But we've had questions about the booster, and then after we do the booster, it's going to be our favorite topic. Dr. Stagg, we're going to go back a few months and talk about ivermectin again, and we'll bring that one back up because I get that question a lot as well. So we're going to bring that up. But let's talk with the three of you about the booster. Dr. Hooks, do you want to talk about where we're at and what you're hearing as well?
Yeah, so the case for boosters is pretty weak at this point, but we're awaiting more data that's trickling in, and we're starting to get that in so that we can formulate a better position on it. In Germany and Israel, they've announced plans for a booster shot program. Other countries like the United Arab Emirates, China, Russia, they've already started administering extra doses A lot of those original vaccines were not mRNA vaccines, but again, those countries have started administering extra doses. I suspect that boosters are going to be recommended at some point, and maybe within the next few months. Likely, it would probably start with the immunocompromised, the elderly, those considered more at risk. But at this time, it's too early to say if and when boosters are going to be widely recommended. We do know that the number of antibodies wanes either with vaccination or natural immunity, but that happens with any vaccine. Your circulating antibodies after any vaccination are going to decrease from what was ramped up after your initial vaccination. But you've got memory in your immune system. So when you get exposed to that pathogen again, your body can re-ramp back up. And so just because in the lab we're seeing, decreased circulating antibodies in some, it doesn't necessarily mean that it's decreased protection from disease. And really, again, the point of the vaccination program is to prevent serious illness and death.
My turn. I would say, well, I'm going to share this. I talked to Dr. Joseph Bocchini, who is a pediatric infectious disease specialist in Shreveport at Willis-Knighton. And he's somebody that I admire and respect. He's very learned. He's got gray hair like I do. And he had some interesting tidbits to share with me. And he did say that we can probably expect to have vaccine boosters in the future. As variants occur, just like in the flu virus, as the virus changes, we may need to do that. He said, his words were, he thinks so, but we'll see, because the data's not in for sure yet. He also said for folks that have previously had COVID, that it's important to get the vaccine. And I think some of the other docs are going to talk about this as well. But he said that the data is very compelling, that helps. Now, I'd have to say I have changed my mind about that one thing based on what we're seeing, because I always thought that natural immunity would trump vaccine immunity any day, based on the experience with chickenpox and measles and things of that sort. But we're finding out with COVID that if you've had COVID before and then take the vaccine, the chances of you contracting it again or having the virus, or being able to, if you have the virus, to transmit the virus is much less. The folks that are getting into trouble that have had the vaccine and COVID are the ones that are immunocompromised, which is a significant portion of the population, especially of folks my age and older. So I would advocate, if you've had COVID, you need to seriously consider taking the vaccine. The data is compelling that it does reduce disease and spread.
Yeah, I agree with that. And we don't know certainly who is going to be recommended for boosters yet. My suspicion is that it will be people over 65, people who are immune compromised for other reasons. I don't know when. I will say that a lot of the scientific research looking at bone marrow studies of patients who have had natural disease or the vaccine are very encouraging, because we're seeing B memory cells and T cells, which we are typically associated with longer term immunity. So I think for a lot of people, the immunity will be long lasting. Of course, it varies from person to person. I think that's how they'll make the decision, is if we see certain populations that are getting infected at a higher rate. And to also emphasize what Dr. Stagg said, for people with previous infection, getting vaccinated probably increases your antibodies by 10-fold or more, based on scientific studies of serum. It does increase B cells and T cells, and most importantly, it decreases the risk of reinfection by about 50%, based on an observational study that was just published last week.
And more to come on booster. And I'm just going to tell you guys, I'm excited. It's a little, as doing this and I'm moderating this, I'm trying to listen as well, because every time these three doctors are on and the medical staff that I listen to, I'm learning just like you are. So it's I'm trying to listen to every word they say and answer questions as well. I want to throw a comment, and then we're going to go to a different topic. Dr. Thurman is a hospitalist and inpatient rehab for Titus Regional Medical Center. And over the last 16 months, he has worked with several doctors and been what we've called our COVID experts of COVID huddles. And he's been over, I want to say probably 850, 900 COVID huddles now at this time. We put something in place in the beginning, which was a brilliant idea by our doctors. Every COVID patient who's admitted in the hospital has a huddle. So we're ensuring they're on the right medication. He's been on a lot of those, so he knows what COVID's done in this community. He's the one at Meet the Teachers tonight, and he sent this text, and it's on the things, but I wanted to read it real quick because it's personal, and this is real. These docs are not kidding, and they're not trying to sell you anything. People are dying, a lot of people. The only people getting severely ill are those who have not been vaccinated. In the 25 years of taking care of seriously ill patients, I have never seen so many previously healthy people die, with us doing everything that we possibly could do. It hurts to watch. Please, please, please get vaccinated. You might be saving your own life and maybe someone else's. And I'm going to leave it at that one, and I appreciate Dr. Thurman taking a few minutes. We're going to talk about ivermectin for a minute because it's a great topic in Northeast Texas, the cattle, and our cattle expert of the doctor panel is laughing. I am going to read, and it may be different than what Dr. Stagg was going to say as well, but it's been interesting. Dr. Thurman, who's been doing research on ivermectin as well, he sent me an email this morning because I asked him just to talk about it, and he told me this. Despite what many people may have read or heard on podcasts that are popular right now, there is still no convincing information that it helps. There has been released very recently some information on some large studies done in countries that have no option but to give medications that they have available. Third world countries do not have as much access to remdesivir or the medicines that we know and that we can use. Those studies seem to have been well done, and we may see the use of ivermectin increase very soon. We are currently reviewing those studies and won't be surprised if we start using it both in our hospital and outpatient setting down the road. Before we recommend anything, we want to be sure that the studies are accurate. I just wanted to throw that out there because that's real, and it's being talked about and on podcast that Dr. Thurman quoted as well. But just wanted to make sure everybody knows where we stand. Dr. Stagg, you want to talk about it or add anything to that?
I'll jump in. I'll say, first of all, don't take veterinary ivermectin. They make ivermectin for people, and it's much safer to get that. I will say, second of all, if you think you need ivermectin, that needs to be a discussion between you and your healthcare provider. It's a relatively inexpensive medicine, but it does have some effects that you need to know about and that you need to take into consideration if you decide to take it. As Terry pointed out, there are a lot of studies out there that we're reading. A lot are anecdotal, which means they look backwards. And those are not as scrutinized and advocate the use of ivermectin. There are some good prospective studies going on presently, which we hope will delineate this better. There are some studies, as he also pointed out, in some of the third world countries that show its effectiveness, but sometimes those studies have some bias in them, and we're trying to sort that out as well. As Dr. Thurman said, this may be a viable treatment option. And again, if you think you want to take ivermectin to prevent or to treat COVID, that's a discussion you need to have with your doctor.
Thanks, Dr. Stagg.
Yeah, I'm done.
No, well, we're going to come back to you one because I've lived in Mount Pleasant going on 19 years now. More than 19, fixed going 20. I raised my kids, me and Angela, taking them to the pediatric clinic and learning from you guys. But I'm going to start with Dr. DeLisi, who is seeing kids as well, and I ask advice of him all the time. I have a great question by Miss McDonald. My son just turned 3. He will not leave his mask on and constantly touches his face and mouth with his hands and pulls it down nonstop. Do I attempt to teach him the mask and how to effectively wear it, or do I keep him home with me this fall? It's very hard for young kids, 2 to 3, to keep masks on right way. Dr. D, this is right up your and Dr. Stagg's alley.
Sure.
So we couldn't leave by at least giving advice of things that y'all believe and have seen.
Yeah, that's a good question. Thank you. And I agree. You know, little children, it's much harder. Some kids, fits like a glove. My oldest daughter had leukemia when she was diagnosed when she was 22 months old, and so she had to wear a mask. The days when nobody was wearing masks for about 3 years because she was immune suppressed on chemotherapy. And she took to it like a fish to water. It was no big deal. She never questioned it or had a hard time, but certainly that's not how every kid is. And it's a challenge. I mean, I think that, for better or for worse, masking will be a part of our future intermittently in different times and different settings. And I think the earlier we can teach kids to do it, the better. It's a tough question, your follow-up question about whether or not, if you can't teach them to wear it effectively, should they stay home? That's a very difficult one. I think there's a lot of factors that go into it, including what the risk is if your son was to bring home COVID from daycare or preschool. If you or your wife or other family had a lot of medical problems or high risk, that could be a reality. If you weren't, then it might be a gamble you're willing to take. But I certainly would try it, encourage it, but they can't be forced. We can't staple it to their face. I don't want to advocate that.
Please don't. We're not recommending that.
Yes.
Tonight. Dr. Stagg, I know you get this a lot with you and Dr. Henry and the pediatricians upstairs. Thoughts?
Well, the thing that we don't want to see is for your son to go home with a Superman mask and come back with a Batman mask. I think you need to be very careful to instruct them. I think instruction at home is very important. As to the fact keeping him home this fall versus sending him to school, that's a decision that you need to make yourself based on your family situation. The American Academy of Pediatrics has come out and recommended that children attend school in person. I can say that.
Thank you, Dr. Stagg. We were getting some questions about the Delta variant, and just want to make sure everybody understands. We cannot tell for the Delta variant when we test for COVID if they're positive or not. That's something we don't see immediately. The state of Texas does take our lab information and runs tests, and we can send it out. You're looking at 4 to 6 weeks to know if somebody's the Delta variant or not. What we've seen and we've reported over the last few weeks and months is based upon the symptoms that are people showing and the high contagious and a lot of outpatient COVID-19, we know that the Delta variant is very effective in Northeast Texas. So just wanted to throw that out there. We received some questions. Want to talk, there's a good question that we received after the question about the comments earlier about getting the vaccine. Dr. Hooks, you want to take this one, and maybe Dr. DeLisi, if you want to talk as well. If I didn't have a reaction to the vaccine, does that mean my immunity is low? And am I more likely to get a severe reaction if I got COVID?
I do want to comment real quick on the Delta variant and us not being able to test for it. That's absolutely true what Harry said. Those tests, it would be 4 to 6 weeks that we would get that result. So it's not something that's done routinely because it won't change the current active treatment that we're providing that patient. What we do know is the disease patterns of what we're seeing right now is consistent with what's described in the literature and other organizations that are dealing with Delta. So that's why we're highly confident that that is the strain that we're dealing with right now. With respect to this question, it's a great question. My opinion, I said I would offer that when it's my opinion, is no. It doesn't mean your immunity is low or that you would get a severe reaction if you get COVID. I say that because degree of side effects from the vaccination is not a marker for successful immunization with it in any studies that I'm aware of. I welcome comments from Dr. DeLisi or Dr. Stagg if they're aware of something different. But as from my understanding of the literature, that's not a way that we measure degree of effectiveness of the vaccine. And there are labs, we do have the ability to draw a lab to test for antibodies, and people who get the vaccine will become positive on lab, typically with positive antibodies. So that would, and if those are present, then there's no reason to think that your degree of protection against the disease would be any different than someone who had a severe reaction.
Yeah, I agree. Yeah, Brandy, I don't think you're any less likely to be immune. You were just blessed to not have a bad reaction at all. Like my wife, who had no symptoms at all from her vaccine, my parents, who had none from theirs. You were just in that smaller percentage that didn't experience any, which is great. But no, I would expect you're still immune.
One of the questions we just have, and we've talked about in the medical staff arena, is which is the best vaccine to get? And we threw this question out there a couple of weeks ago when we were talking to different groups on the medical staff to know from a hospital's perspective which vaccine we should fight for to make sure we're getting. The answer we got consistently was Moderna. And the reason given, it had the highest rate of on the first dose being effective the quickest, even though it's a 28-day. So we did continue to get the Moderna. Again, we've looked at different results. We've gotten different information from different people. Do any of you docs have anything else on that one? It's an opinion, but we are giving Moderna and Pfizer for 17 and under now. Any thoughts that you want to throw in there on the vaccine?
Sure.
Yeah, go ahead, Dr. Stack.
Go ahead,
You
Will.
go.
Go ahead, Will.
Okay. No, it is an opinion. And when people ask me that question, I say Moderna because it's the one that I got. And for the reason you stated, we seem to may have some evidence of a more robust response to the initial dose. So you might have a little bit earlier protection from that. But really, the best vaccine is the one that you can get, which is available to you in your area that you can get is the best one to get.
And I would say, from our perspective as pediatricians, we're primarily interested in the Pfizer vaccine because it's the only one approved under 18 right now, down to age 12. We do think the mRNA vaccines are better vaccines, and Moderna hopes soon to be approved for that as well, and at even younger age. I want to say one last thing too, one more thing about if I didn't have a reaction to the vaccine, did I get antibodies? There are a lot of folks that get COVID and don't really get sick. And they're worried that they don't have any immunity as well. But we're finding out after the fact that they do produce antibodies and they do have some immunity from that. So I think you can draw a parallel to that to the vaccine.
One of the questions that we received is that I just love on this one is what resources that you recommend or reputable sources besides the CDC. I just want to pick your brain for a minute. Where are you getting your information? Where would you encourage us as community members to look for guidance? I know you're going to all recommend that we go to Titus Regional Medical Center Facebook and internet on a consistent basis and look to see what the hospital and the medical staff recommends, and we appreciate that. But in addition to the CDC and Titus Regional, what other resources would you guys recommend for our community to focus on and look at? Dr. DeLisi, you want to start, and we'll just let each one of you?
Yeah, the CDC is helpful just because they have everything there. The website is just if you're a math nerd or statistician, you'll love it because there's so much there. I tend to read articles from different journals or try to read original articles if they're linked from newspaper articles like the New York Times and things like that. I like Francis Collins. He's the director of the NIH, National Institutes of Health. That probably most people didn't know him before last year, but he's been sort of a medical role model of mine for years. Tremendously accomplished guy and high character guy, follower of Jesus, which I've always appreciated. And those are the main places I look. But the CDC certainly is the standard. But there's also lots of hospitals have websites. WebMD is a good source. Mayo Clinic has lots of good resources. Those are good places to look.
Dr. Stagg?
Sure. I'd also recommend you can go to the Texas Department of Health website, which has a lot of information, as many states do now. Granted, some of that information does come directly from the CDC. From a pediatric standpoint, the American Academy of Pediatrics has a website that has information that's fairly reputable now. So that's what I would recommend.
Dr. Hooks?
For me, I look at, I agree the Texas Department of Health has great data and statistics regarding COVID. I like to look at Johns Hopkins, Bloomberg School of Public Health. They have a lot of good information that they put out. The University of Missouri is another place that I've looked. Nature Journal has good original articles that I've looked at. And the professional societies like the American College of Obstetrics and Gynecology, the Society for Maternal Fetal Medicine, and the American Medical Association.
Docs, I truly appreciate it. We're getting close to that 6:45, and I want to be respectful of everybody's time tonight. There was two quick questions that come in that I just wanted to address real quick. One was for the vaccine for the 17 to 12. It is Pfizer. That is 2 doses. 21 days apart. So the Pfizer vaccine, you'll get your vaccine. 21 days later, you'll get the second vaccine from the Pfizer. The other question that was great from a close friend of ours, from Mary, how long does it take to develop antibodies after being vaccinated? Dr. DeLisi, or any y'all want to clarify that one? Because I think that's a great one to get out tonight.
Yeah, it starts right away. I think from the first shot, but as far as being completely immunized and have full immunity, it's considered to be 2 weeks after the second dose. So for the Pfizer, that could be shot 3 weeks, and then 2 weeks later, and the Moderna shot 4 weeks, and then 2 weeks later. But it's not like you have no immunity until that magic point.
Gentlemen, I just want to say thank you. I want an opportunity to at least go and let you finish and give closing statements, each one of you. We're going to go. We're going to start with Dr. Hooks, and then Dr. DeLisi. Then we'll finish with our 40-year individual. We'll finish with the Godfather for the medical staff. Dr. Williams has been on medical staff longer, if he's listening as well. But Dr. Hooks, would you like to closing remarks, and we'll go from there.
Okay. Thanks again for joining us, and hopefully some of your questions have been answered. Like I said when I opened, we are in a healthcare crisis. The Delta strain is here. It's affecting us. It has in some ways changed the rules of the game because COVID no longer severely affects just the elderly and the immunocompromised or those considered high at risk. We're seeing it severely affect younger people. People in their 40s are contracting it and dying. People in their 30s are contracting it and dying. People in their 20s are contracting it and dying. And children are contracting it. So it's here, and it's time that we all step up and do what we can to protect ourselves and our loved ones. The best way to do that is with a vaccine, not only for yourself and your family, but for your community, wherever your community is that's likely struggling to care for all of the patients, not only with COVID, but also with other life-threatening diseases that has been difficult to manage because of the influx of COVID patients. So I'm happy to answer further questions offline if anyone has them. But again, thank you for your attention.
Dr. DeLisi?
Yes. One question that wasn't asked, but I think is probably the most common one that I'm asked by people who don't get the vaccine, is about long-term side effects. And I think it's important to say that this is something that's concerned the general public greatly, but physicians very little, because it's something we almost see none of in the history of vaccines. From the first vaccine that Edward Jenner discovered in the 1700s, which was smallpox, till now, there's really not been side effects that have appeared more than about 2 months after the dose of a vaccine's been given. And so we, at this point, with as many people as we've had vaccinated, we have a lot of real life use data, more than we have of vaccines that have been given in the United States for 10 years, just because so many people who have taken it. My final message really is just imploring people to consider it, to please get vaccinated. Last year when we did this, the early town hall, we really had not much more to offer than a wishful hope. We didn't know what was coming. We didn't know what we were doing. A year and a half later, I can say that our treatments, while they've improved somewhat, are not as good as we would hope to be this far into the game. Viruses are difficult, and this one's proved to be that way. We still don't have a cure. We still don't have a magic bullet. Once this virus gets in the lungs, it's very dangerous and very deadly. But what we have is better. We have prevention. And in primary care, prevention beats treatment and cure every single time. And it's harder and harder to watch people I care about get sick with this virus and end up in the hospital or pass away. It was hard a year ago. It's been hard all along the journey. It's always been tragic, but now it feels like preventable tragedy. And that's hard in a different kind of way. I believe if we were all vaccinated from this virus, the virus would not be an issue. It would be gone. And so I ask that you would do that. And I ask, the other thing that I would implore, just from so many conversations with so many patients, is to not consider the virus synonymous with our government. The government paved the way for it to happen. The Trump administration did. They did not produce the virus. It was produced, the vaccine. The vaccine was produced by the usual people who make vaccines, and it's an excellent vaccine. We're Texans. The best way to get a Texan to not do something is tell them that they have to. I would ask that that we change that regarding this. Our leaders have gotten vaccinated. President Trump was vaccinated. Governor Abbott was vaccinated. Governor DeSantis was vaccinated. They didn't do that for fanfare or show. They did it because they're smart men. They know that there's value in doing this. And the last thing I can say, actions speak louder than words. Not only did I race to the hospital in December when they said they had a dose of vaccine to give me, but before I'm a physician, I'm a husband, I'm a father, I'm a son, I'm a friend, and my wife has had this vaccine. My 8 oldest children who are age eligible have had this vaccine. My parents have had it. Her parents have had it. My sister and her family, just about every person that I love most in the world has had this shot. And there's no reason that I would recommend it to them other than that I think it's good and safe and right and best and protective. And I can say with complete sincerity, if you were sitting in front of me as a patient or as a stranger, that this vaccine would be good and right and safe and beneficial for you. And so I just implore that you would please take it.
Okay, I guess it's mine. It's my turn. I'm old enough to remember when the Salk vaccine came out for polio. We lined up at the local gymnasium to get a sugar cube with the drops on it. That vaccine came out pretty quick and has proved to be very useful in preventing polio, which was wreaking havoc during that time. Right now, if you go to the Texas Department of Health website, you'll see that the positivity rate for tests done in Texas is in the high teens. It was at 2% just a few months ago. So we're experiencing quite an outbreak, and our community is very similar to many of the communities. Baylor, Scott and White and Temple is locked up. They're full. So is the hospital in Wichita Falls. I can vouch for those because I have good, reliable sources there. I can tell you that the Children's Hospitals in Dallas has a difficulty because of both an RSV outbreak and the COVID that they're experiencing. Fortunately for children, COVID's not really a big issue because most kids handle it pretty well, but then they go home. So I would encourage everybody at home to be vaccinated because that can limit that spread that child may bring home from school. If a child is eligible to get the vaccine, we do recommend that for the reasons that we said, and both these physicians that I'm on with have eloquently said. I will say one more time, there are other things you can do besides vaccination. You can mask, you can sanitize, teach children to wash their hands. I mean, first place a kid puts his hands when he touches something is in his mouth. So teach him to wash his hands, and I think that's important. Let's all do our part in this pandemic because we're facing quite a hurdle. As you've heard from the hospital administrator, our hospital is full, and we're keeping people in the emergency room that really should be on the floor because we haven't a place else to put them. So let's do what we can, and I think vaccination is very important for everybody that can get it.
Thank you, sir. We had one last question coming in, and I truly believe things happen for a reason, and this question's perfect because I want to end with this question. Does the hospital profit monetarily from the vaccine being administered? As a CEO of Titus Regional Medical Center and as a CPA, I can tell you no, we do not profit from it. I will tell you Titus Regional Medical Center has made the decision to fund the vaccine clinic at no charge. When you go and register for the vaccine in our lobby on Monday to Thursday from 7:30 to 1:30, on Tuesdays from 7:30 a.m. to 7:30 p.m., we don't get your credit card information. We don't get your insurance information. All we ask is you sign the piece of paper, you get the vaccine, and you help our community. We believe as the Health Center of Northeast Texas, it is our responsibility to provide this at no charge to this community. The government does not charge us for us. They provide us the vaccine. Titus Regional Medical Center and our medical staff believe we should be giving the people to give the vaccine. So we don't charge for it and we don't make money for it. But we do believe it's the right thing. I have been vaccinated, and I would encourage you to get vaccinated because, as you heard tonight, you will save a life or you will save your loved one's life. Dr. DeLisi, Dr. Stagg, Dr. Hooks, I'm honored to be able to share this with you tonight, and I truly appreciate you guys giving up your time, and I truly appreciate the community for joining us tonight to spread the news. We appreciate the support. Thank you for attending tonight. God bless.